But I do think that we have done and achieved the goal of what the task force is tasked with doing. Um, I think that when we started, we struggled to do it, but under Lee and Lou and Al and the entire task force leadership, we have gained attention for this crisis. And I've learned a lot from this task force. And I think that we have a long way to go to bring the resources that we need to our community during this pandemic. Um, there was a stall in responses, but this task force kept the pandemic of overdoses on the front burner in the minds of government agencies. I don't know if there's another task force like this that we have the support of the city, the state, and the county and the federal government that comes to the table and learn from the members of this task force. So thank you very much for that. And I'll just tell you the greatest lesson that I've learned from this task force was that they may use drugs, and and it's not our job to tell them that they shouldn't use drugs. It's our job to support them where they're at and make sure that we meet their needs. If that means that getting them a safe place to possibly to use, then we have to consider that, because the alternative is a place where they're alone and they could possibly die of an overdose because they didn't have a safe place. I've also learned that overdoses of heroin, they don't have to be fatal. There is a reversal. And this task force has done a great job of raising awareness about making sure that people know that they should get Narcan. And Narcan should be in every household. And the state, the city, and the county knows that we are promoting that as a task force. And we also, I've learned through this task force that that people have to. There's this MAT. I mean, it's been talked about for many years. Medical assistant treatment. So this task force has been going on since 2016. So people need to know what those terms mean. They need to know what MAT stands for. And because of this task force, I think that many people know what that means. They know what Narcan is. They know what it means to seek help if they need it, and they know where to find that help because of the work of the task force. It's also been great because all of the providers, or a lot of the providers, have come together to share their resources in one place. And I think because of that, we've all become better, and we know best practices from every different angle of this pandemic that we have as relates to the heroin opioid crisis in our city. So for that, I thank all of you for bringing your expert advice and your opinions. And this meeting, I hope that we recall the last meeting when we were, I can't recall where, but where I said that we need to make a demand, that we need to have a demand for the need on the west side of Chicago to receive more revenue for the task force and for the agencies that are a part of the task force. So hopefully you'll be able to put together something with the task force so that we can achieve greater goals for the crisis that we have on the west side as it relates to overdose prevention and providing people with the necessary support for a substance use disorder. And it's great that we because of the work of the task force, I think that it's important to note, in case people don't know, we've been asked as a West Side Task Force to support a South Side Task Force. And Lee and Lou and Al and the full task force leadership team, Sandra, they've all been assisting the kickstart of a South Side Task Force. So maybe one day the two task force will meet, South Side and West Side come together, and I think that that's going to be very helpful when we all come together and make a stronger demand from the city, state, and county and federal government to eradicate the overdoses and the fatal overdoses in our community. And finally, there is a move. We think we will pass a bill this year to make sure that everyone that goes to the emergency room for an overdose, when they leave, they will receive Narcan at discharge. I'm happy to report that the Loretto Hospital, I don't know if Mr. Miller, President Miller is on, but he started that already. So if people overdose and they come into the Loretto Hospital, when they leave, he provides them with Narcan before they leave. And so there will be other bills that we will be working on. I'm working with Dr. Huggett and other people to work on the prescription monitoring program to make sure that people, when they receive certain MATs, individuals from other providers will be notified. I think that there is a disconnect when it comes to, I think it's methadone. I don't think people are able to communicate with other providers so that people know that a patient may be on methadone. They go to one provider and they may receive Suboxone or Vivitrol or something else, and the provider that's prescribing may not know it. So there's some work in Springfield going on for that. So we're happy to report that. And the other bill that we're working on with Dr. Huggett and other providers is a bill to make sure that Medicaid recipients have the ability to get their prescriptions wherever the closest place to their, wherever they at. So right now, Medicaid that's been, has a contract with Aetna, and Aetna and CVS are one, and they've disconnected Medicaid recipients, clients from using any pharmacist just about except CVS. So we're going to work on that because we do believe that people with substance use disorders, they do have other underlying conditions, but they also need their prescriptions like Suboxone. And we don't want them to have to resort to using street drugs because they can't get to the prescription drug for those that have chosen to use a prescription drug over a street drug. So with that,
before you go on, thank you for sharing that. I mean, that's really good information. But before you go on, we have a question in the chat box that asks if you could give us those bill numbers.
Yeah, so those bill numbers will be reported to the committee, to the task force once they're completely drafted. Right now, they're all being negotiated so that we could try to file an agreed bill before we file it.
Awesome, thank you.
That
no other questions.
Thank you. I'm sorry, I'll turn it back over to Lee. Thank you, Lee and Sandra.
Well, I think at this point, I'd really ask the members of the task force and the 70 plus people that are 80 plus people that are on this, if you have questions regarding some of the legislative things happening, I know you gave us an overview, Rep. Ford, but if you have some questions or some input of some areas that we'd like to focus on with you during this year, to start putting those questions or comments in the comment section, and then Sandra will read them off And again, as I mentioned, if you like to elaborate on your comment, then you can raise your hand and she could unmute you so you could elaborate. So,
Oh, and also if I could just tell you that there is one more bill that I didn't speak to, and that's the overdose prevention site. Prevention site that's already filed, and the task force was thrown off because I didn't advise them when I was filing it, but it is filed, and I'll put that in the chat so you guys can have it.
Then we're going to hear from Ed Boone.
Yes, good afternoon, everyone. Is there a date for the South Side Task Force? I saw at another partners meeting that there was a upcoming meeting. Is there a date yet?
Dora might be able to answer that, or I don't know if Florence is on the line. I know they just had one.
Yes, good morning, everyone. Yes, there is. And Ed, what I'll do is I will put the flyer in the chat box.
Awesome. Thank you so very much. We also have Dr. Vachon with his hand up.
Oh, thanks. Yeah.
Another message from the chat box. Thanks, Dr. Vachon.
Yes, thank you. Quick question, Representative Ford, thank you for the legislative update. Do you see that as like one piece and then the budget and funding piece as a separate piece, or are you putting those together in your kind of how you think about them, legislation?
No, Dr. Vachon, the two would be separate. One will be appropriations, and the other will be legislative. Yeah, so that's good. I think that it would be great if we have a, and let me just preface and say that the governor is talking about major cuts because the constitutional amendment, the progressive tax didn't pass, which would have gotten, which would have taxed the high-end earners more, which would have brought in billions of dollars to the state. So the governor is saying that if we don't raise the flat tax, then there's going to be major cuts. So however it turns out, what's important is that we as a task force have our agenda in place and stand up for those with substance use disorders and make sure that we don't allow for cuts to happen in this area, because this is too critical to allow for this to experience any cuts. So that's one major task that I think this task force has right now, to stand in the way of any cuts to substance use treatment.
Right on. And I mean, there's just, downstream budget impacts by cutting, services for substance use disorder. It would be shooting yourself in the foot in a lot of ways.
Sure, I think that,
yeah, I'm sorry.
Yeah, go ahead.
Somehow. Okay.
No, I was just gonna, I know that there are some questions, and Dr. Fisher could probably answer it, I'm not sure. That question was, do methadone patients still have confidentiality regarding their enrollment in the treatment, or is that information now included in the PMP prescription monitoring program? Dr. Fisher?
It sounds like the legislation is, intended to allow for seeing that in the PMP, the methadone treatment. It would still be confidential, just as all other findings on the PMP are confidential. But you would be able to see it as a user of the PMP, is what I understand.
Thank you so much for that response, Dr. Vachon. Before we get to the other questions in the chat box, I want to recognize Chelsea, who's had her hand up for a while. Chelsea, if you can unmute yourself, you're free to speak. Hi, how are you?
Hi, everybody. Hi, Rep. Ford and Lee and Dora and everybody. I actually, as you are all talking, and by the way, I have like 8 questions, but I'll keep it to 1. I do have concerns about, and I think a lot of people do, about the confidentiality for those people who don't want other providers seeing their information. I think that's definitely not something we should just push to the side. It's a real concern. 42 CFR Part 2 gives them that right. But I guess the question I have is, before the lame duck, or during the lame duck, Health and Human Services bill did not get approved. There was a lot of talk about it and it kind of ended up being put on hold. I'm just wondering if Rep. Ford, you can update us on the status of that bill. And specifically, I think a lot of us are wondering about what's happening with the Good Samaritan law protections expansion. That bill was really descriptive with it. And so I guess we're concerned about that piece of it too.
Yeah. Well, thank you. I also like to see your pictures of your baby boy too. So congratulations on a healthy baby boy. Remember when he was born?
Oh, thank you. He's almost 2 now.
Yeah. So the Good Samaritan is another piece of legislation that we will be working on as well. That was in the big bill that passed the House but failed the Senate, or didn't get called in the Senate, and the Senate had a bill that didn't have everything in it and it wasn't called in the House. So these bills will run again in a big omnibus bill, but I'm going to also run some single bills to each issue, just in case we have a problem with the big bill. So, and I'm glad that you spoke up about the PMP, so that, because I hadn't heard any pushback. So it's good to hear you say that there are some concerns. Hopefully we can offer some solutions.
Thank you.
Thank you for your question. Before we get to Mark, and I see your hand up, Mark, I want to get Dan Rabbit's question in. The Illinois Legislative Black Caucus included funding for community health workers in their health package. It did not get passed in the lame duck session. Can Rep. Ford comment on its prospects, and could the West Side Task Force consider supporting it?
Is that what the big omnibus bill that did not pass the Senate is that what? Because it went in and out, maybe my internet.
I am sorry. The Illinois Legislative Black Caucus included funding for community health workers in their healthcare package. And the question is, because it didn't get passed in the lame duck session, someone wants you to comment on the prospects, and could it get supported by this task force? And the question is posed by Dan Rabbit.
Yes, absolutely. This is something that will be, Rep. Lilly refiled it immediately after for the 102nd General Assembly. So I think that we should definitely support Rep. Lilly's bill, which has everything in it just about that we're talking about, including the funding for community workers. So, there will be some pushback on certain things. And so that's why we will run solo bills as well. But the community workers language is very important. So hopefully we'll be able to pass that. Once again, it's at a time when the governor is threatening cuts to social services. So we got to be aware of that as well. And when the time comes, I have to say, when the time comes for, if there is people are going to tell us as members of the General Assembly that the people have spoken and they don't want new taxes. And so there's going to be a push against any revenue enhancements because the constitutional amendment failed. And so the question that's going to be on our plate is, do we vote for a tax increase when some people will tell you and tell us, vote no, because the people have already spoken about a income tax increase. So we'll be in a situation where we have to raise taxes if it comes across the desk or across the board, but there are people that's going to be against it. So organizations like this have to speak up and tell us what we want to do.
Awesome. Thank you so much for that. I'm going to get Mark Sanders into the conversation. He's had his hand up for a while. Mark, I'm going to start while you're unmuting yourself with your question. Along with leaving, emergency rooms with Narcan after surviving an overdose, of course, it would be helpful to be offered a recovery coach. 15% of individuals that survive an overdose will die of an overdose within that year. Mark, respond.
Yeah, so I just wanted to just elaborate a bit on that. So I had this vision that every hospital in the state and the country that are concerned about overdose deaths, that literally they will have recovery coaches working within those hospitals. And not only can they be helpful in providing ongoing recovery support, but I've actually talked to some recovery coaches that work in hospitals, and they also are helpful in reducing the stigma of addiction amongst people that work in hospitals, because they don't just see people coming in sick off of opiates, but they also see people in recovery that they can talk to, real live people in recovery. The other is, I think Cook County Jail sits on the west side. And we know that individuals have been incarcerated for a long period of time, or individuals who've been hospitalized for a long period of time. They're more vulnerable to die of an overdose when they leave these institutions. So I also had this vision, this idea that one day people will leave Cook County Jail, and those that we know have addiction, substance use challenges, they too will be offered the opportunity to work with recovery coaches, individuals with lived experience. And I know that Lee Rush and the program that he works in, and Lou, who I interviewed not too long ago, and Thresholds, and Dora's program on the West Side, all offer these recovery coaches. And those are my thoughts. And one thing I want to say, it's taken me a year to be able to get here because I have these meetings, but this is the most amazing thing that I've heard. This is the most amazing thing. And I've been a drug counselor for 38 years. And I've never seen it where a county, a city, and the state are working together to do this work. So I just want to really encourage you to keep doing what you're doing. And I'll keep my ear there so I can listen and be as helpful as I can in my small way.
Hey, Mark Saunders, I think what you raise is something fantastic about working with Cook County Jail, because, you know, most of the people that return from Cook County Jail detainment come to the West Side. Mm-hmm. And so we should have a stronger relationship with Sheriff Dart, and I think we do. Everyone in this task force have relationships with Dart, but I think we should do better with making sure that we have support for those that's incarcerated at the county. And I think I see Bruce Miller on. Bruce, you ready to reach out to Tom Dart and tell him that they could come right over there? You're close. You're the closest to him, I think.
You know, absolutely. I'm blanking. I did just have somebody from the system call, and they were trying to organize. I'm trying to think of her name right now, but we spent about a half hour on the phone, and she was working on exactly that, primarily focused on women, I think, in her case, but women who are being discharged from the jail and are trying to come back to the neighborhood. So we told her we would be thrilled to work with her to help women in transition back to the community, to have a primary care provider and to be able to work with them in our program. So we would love to be involved.
Yeah, and Mark, I got to tell you, Bruce sent Dr. Huggett to the county. We went to Cook County Jail about a year and a half, and we met with Tom Dart and his whole team. And we need to get back with that. So yeah, so that's good. He's aware of the task force, and we will get back with that, Mark. Thanks.
Thank you.
Thank you for that question, Mark. And I got to tell you before we move forward that you have had such a wonderful response in the chat box. So thank you so much for bringing that point up and having a discussion around it. We have a question in the chat box from Pastor Mack. And Pastor Mack, if you want to unmute yourself, you can speak more to this. Have we begun to develop an outreach or support to our young people, to the youth who are using opioids that have been affected by the usage of a family member even? That question is posed by Pastor Mack.
I would like to elaborate on that question a little bit as well. And I think it made its point, but I wanted to just make sure I kind of closed it in on the clarity of the part about being affected by the usage of others, right? Our young people sometimes are exposed to family members who are either have overdosed. That's a traumatic experience to see, be a part of, or either are in a situation where they're seeing consistent drug use or the effects of it. So then there's a psychological impact there, that also could lead to a pipeline of drug use in the home or through generational or other family members, et cetera. So I just don't want us to lose sight of that while we're looking at it from one end. Let's make sure that we're on the other end of it as well.
Well, to that point also, that's why that's why this task force is special too, because that's the work that Prevention Partnership does. They deal with schools and they deal with the youth. And so Al, are you still there? Al is there.
Yes, I am. Yes, I am. Yes.
So that might be, that I think you heard a charge for,
Yes.
Yep. Do you want to
Yes,
speak?
we're actually now exploring the possibility of submitting a federal grant to actually target youth and to look at the gaps of where that is. And so that is a priority of ours. And we do have information on the need, not specifically the opioid need. There are some questions on the Illinois Youth Survey that talk about the opioid need. And we can pull that information from there. But we really need to identify and look at where that need is and begin to develop programs around that. So our intentions are to look at this federal application and to compete for it. They're going to be giving 11 awards away. And we're hopeful that with the great work of the task force that we will at least submit a competitive proposal. But that is definitely our priority as an agency.
Thank you, Al. And to that, submitting proposals, I think it's important to note that the task force is always happy to provide letters of support to anybody that's submitting grant proposals. So always feel free to ask for a letter of support from our office. Jonathan Tate is on, and we'll make sure that we get you a letter of support for your proposals. And I think that and unless everybody's being competitive, I don't know if other members of the task force would even do the same thing for you.
Mm-hmm.
We have some really good information in the chat box. And again, we will make sure to get this information copied and we will send it out to everyone. But we have just a few more questions I want to hit on before we move forward. Are there recovery coaches in hospital staff? Do hospitals have recovery coaches? And that question is posed by Kevin Pearson. Kevin, you can unmute yourself if you want to speak more to that.
Hello. Yes, my name is Kevin Pearson. I'm a program aide for Pathfinders Prevention Education Fund. And my question was to Mark regarding the recovery coaches. And I was trying to see, are they hospital staff members, the recovery coaches, or are they there representing a third party?
I've seen both models. I've seen some hospitals across the country be thoughtful enough to know that they needed to hire their own recovery coaches. Mm-hmm. Then I've seen organizations provide recovery coaches for hospitals. So actually I've seen both. The best thing I've seen are a handful of hospitals in Illinois that have women working with pregnant women who are addicted to opiates, and they double as certified doulas and also certified recovery coaches. So they can let the women know, not only can I help you with the delivery of your child, if you want, I can support your recovery. I'm also a recovery coach. Oh, wow. So we're only limited by the ideas that can come in our mind around that.
Wow, thank you so much. And Peter posed a question. In patients that are receiving outpatient treatment, I think here, he wants to know if given consent, or let me back out of that one. Does not giving consent mean that someone would be denied treatment? And Peter, if I'm chopping that question up, please kind of help me. It reads, if the patient in an OTP does not give informed consent for PMP, will they be denied service?
This is a big topic of conversation in other chat rooms for methadone patients. And people are feeling that their states are pressuring them to involve themselves in the prescription monitoring programs that are offered in the states. The whether informed consent, it seems coerced informed consent may be a better term in some of the states. And I would hope that we're not
I would hope that we're not moving in that direction. I've always had faith in Richard Weisskopf taking care of the methadone patients here. An offer is one thing, coercion is something else. I'm just wondering how Illinois is moving in that direction, so I could kind of report back and say, this is how our state's looking at it. That's all.
Awesome.
And I've been texting Dr. Huggett on this, and he's advised me that no one will be denied access to care. But it's very good. Peter, are you in favor of the change to the prescription management program?
I understand the reasonings behind it. I think it can be helpful, but again, the stigma and the marginalization that methadone patients have had to endure, I think this just provides another in. And when you say, sure, only people have access to the program that need access to it, that would be law enforcement in many states. That would not just be physicians. That would not just be MDs. That would be physician assistants. And so, I mean, nurses in some states can access these records. When you say it's going to be only the people that can access it, that doesn't hold my hand very well. I'm not sure how it is in our state, but from reports in other states are very lax in how they look at this. So that's why I'm bringing it up.
So let me ask you, Peter, and everyone else, if you could just advise on this part. Is there a need for this reporting? And are there dangers of not having it?
Well, certainly there's a need for the reporting. Prevent doctor shopping, a favorite pastime of mine in the past, and easily accomplished. Still easily accomplished. I believe that I can just go to Muncie or Gary, and the prescription monitoring program does not extend across state lines yet. But as far as methadone patients, again, I just feel they have been singled out in very damaging ways, and I'd like to see them singled out in a way that helps to protect them.
Is it true though that other substance treatment medicines are a part of the PMP? Like
I don't know. Other people, buprenorphine. All buprenorphine patients are in the PMP. I don't know.
Yeah.
People would
yes, they are. You can find them in the PMP as long as it comes from a doctor. If it comes through a hospital, it's not going to show up in the PMP.
Only one that's left out is methadone.
This is Dr. Fitzgerald.
I'm sorry, she's going to jump in, but I just wanted to kind of shout out that Ruchi had some concerns, so I'm glad you're on, Ruchi.
No concerns. So this is Dr. Fitzgerald. I have a few roles. So I'm over at PCC where I work clinically, and then I also have a position at Rush, but I'm also have the opportunity of chairing the policy committee with the Illinois Society of Addiction Medicine. And so that's really offers an opportunity for many of our clinicians throughout the entire state of Illinois to offer their input with regards to this specific issue. And we've been tossing around the idea of kind of a listening session on this topic. And we interface routinely with Sarah Pointer from the PDMP. So I think that there are many clinicians themselves who have concerns about this exact issue. I do want to let some people know that a lot of times on the inpatient side, we do struggle to confirm methadone dosages. So I will let people know that there might be a couple of days that go by where people do not get their methadone in the hospital because we cannot confirm their methadone dosage. It can be really difficult to do that. And then if 72 to 96 hours goes by, it's technically a new start. So those are all really, really not great things. And there are many safety events that occur on the inpatient side. So we always try to approach things. I like personally to see things from all sides and think those listening sessions can be really helpful. We've kind of explored things from a few medical directors of methadone programs and heard a lot of different approaches about how they would do the consent. No one would be forced. And then some methadone programs are like, we are not even going there. Our patients would not want to sign it. So I think it's time for ISAM to really start opening these sessions up. And I am very happy to work on this from the policy lens with the West Side Heroin Opioid Task Force, and just think that it would be an opportunity for those who are actually engaged in methadone programs to really have their voices heard.
Thank you so much, Ruchi, for that. I appreciate. I just want to bounce back and go through a few responses that we had earlier. Bella wanted to remind us that also the Coordinate the Care program, a treatment navigation program free for anyone living in Illinois. And she left information for that in the chat. Sue Pickett also said that the great project that Mark was referring to is described about doulas were also CPRS is a project funded by Super. So that information also is in the chat box. Tony Daniels has a question. Are doctors responsible for providing resources for treatment to those who they have prescribed opioid drugs to once, but has been cleared of that addiction? I'm sorry, he is not part of our regular group and is looking for some clarity. Can someone please respond to Tony?
Dr. Fitzgerald, maybe.
Is that question up in the chat box? What was that again?
It is, and I can read it again, Doctor. Thank you so much.
Oh, I'm seeing it.
No worries. Are doctors responsible for providing resources for treatment to those who they have prescribed opioid drugs to once it's clear there is an addiction?
Well, I mean, there's multiple facets to this. Certainly one of them is, do no harm. And if the particular medication you're prescribing is harmful for that individual, then there definitely is not a responsibility to give that. But in a broader sense, I think there's a responsibility on the medical community to become skilled at helping those with addiction, which is in part connecting them with other recovery services and doing MAT. Now that may not be every clinician that's able to do that, but getting them connected with a clinician that can. So I think there's different pieces to this. Yeah, there is a responsibility to to treat, but not with something that's harmful for that person particularly.
Awesome.
Yeah, this is Dr. Fitzgerald. Are they responsible? I would say that not every doctor views that, and not every doctor is licensed with a buprenorphine waiver. And obviously methadone comes out of an opioid treatment program, so that's federally regulated. So there are unfortunately numerous barriers for many clinicians, and that's disappointing at this point in time. And that's one of the reasons we're gathered here today. And certainly, we still have many clinicians who don't prescribe naloxone for overdose prevention. So those are just some of my thoughts on all of the issues.
Awesome.
Yeah.
Thank you so much. Our final question here before we turn it back over to you, Mr. Rush, is from Deborah Williams to everyone. And she is saying, first of all, kudos to the task force as you guys move into our 5th year. She's interested in knowing if there is going to be a comprehensive report that showcases and talks about the impact this task force has had on its community.
Absolutely. I think that we will work on that. Al is a real good numbers guy, and that's why the surveys are very important. And so if we continue to do the surveys that's been asked, that really helps get a comprehensive report. We need that report anyway, so that we can also show the work that we're doing to my colleagues, so that we could get appropriations to support all of the agencies on here. So Al, you ready to do that report?
Well, we do have for the West Side, because of the great cooperation of the network chiefs and the building principals on the Illinois Youth Survey, which is the state's vehicle for looking at change. 100% registration, which was about 40-some elementary and high schools who signed up to take the survey. And in 2018, we had 93% actually took it. And in 2020, because of the COVID, we had 100% registration. And because of the COVID, it stopped. And we had, I think it was 63% participation. We do have community surveys available on the Illinois Youth Survey per community for Austin, North Lawndale, East and West Garfield. And the Illinois Youth Survey is administered by the University of Illinois Normal Champaign School of Social Work, Center for Prevention, Research and Development. And I can get those community surveys to Lee so that if anybody's interested, we can certainly get those to individuals as well. But I'm very, very impressed with the response and the cooperation from the building principals and from the network chiefs in terms of their leadership. And so we do have good, solid data for the West Side. Probably the best response to well, I know it's the best response for the Illinois survey than any of the other Chicago communities. So hats off to our educational leaders.
Oh, I also mentioned we'll have a report that's really follows the CDC model for community involvement and engagement. We're still, it's not going to be totally aligned to reducing the numbers of overdoses in the sense that we're not going to be able to show that it has that direct impact. But based on all the issues of COVID and et cetera, we're still seeing a spike, or at least a higher level of it than we had before COVID. So, but yes, we'll make sure that we get relevant information in the report by the end of this year on work that we've done, especially since Prevention Partnership's been involved in it since July of 2019. We're kind of moving into about 5 minutes to go before I want to make sure that Tim Jackson and Sue Pickett are able to do their announcements. And, we could probably stay here and do this for a couple hours. This is such a great group of people. Maybe we'll have to do 2-hour meetings from here on out. And, it's always kind of disappointing that we have to do this by Zoom, because a lot of times in our face-to-face meetings, the pre-meeting and the post-meeting were really great for the networking that really has brought us all together. But, we do the best we can. So are there there's some couple other hands raised before we leave, and I don't mean to take your role from you, Sandra, but maybe I can't see everybody. I don't know if there's other hands raised. And
I too was a bit concerned about the raised hands, but I believe those were Dr. Fitzgerald and Mark Sanders, who did not put their hands down. So unless someone has additional questions, comments, or concerns in this area, I think we're free to move forward, Lee.
But let me just also mention that if anybody or group wants to have a Zoom meeting in between our regularly scheduled full task force meetings, I'll be glad to set that up around, whether it's around topics of the kind of the street to treatment, warm handoff process, or the community engagement process, or any of that. Let us know and we can set it up and get the folks together. We really don't have committees right now. It's been kind of an all skate, but ad hoc committees can form at any given point, and we'll be glad to support that. So let me know via a phone call or from our West Side Task Force at yahoo.com.
And please do not hesitate in asking us to support you on tech support for those task force issues. Right. We certainly do not.
Exactly. So why don't we move to Tim Jackson? We've asked to give some information about what's happening with the Illinois Harm Reduction and Recovery Coalition. Tim, are you there?
I am. Thank you so much, Lee, for the invitation to join you all today. Before I get started, Representative Ford, I do want to let you know that we'll definitely be reaching out to you about those bills that you mentioned earlier. My name is Timothy Jackson. I'm the Director of Government Relations for AIDS Foundation Chicago. and also serve as chair of our new diversity and inclusion work group with the Illinois Harm Reduction and Recovery Coalition. And so just to kind of go over, of course, we understand that harm reduction has many intersections, from racial equity, of course, the LGBTQ community, decarceration, healthcare, reproductive justice, and really kind of the list goes on, of course, injection drug use. And so we want to be very intentional about including everyone in the decisions that the coalition, the statewide coalition, is making. And so we are doing this very intentional effort to grow the coalition, and we would love to have you all a part. You know, when we hear the word diversity, a lot of times we kind of default to skin color, race, ethnicity. But when we talk about diversity, it's not only that, but it's also geography, that making sure that our group is not just Chicago, Cook County centric, that we have representation from across the state, that we have the thoughts of people that are with lived experience, that's important too, that we have that meaningful engagement really central to the work that we're doing as a coalition. And so again, like I said, want to be very, very intentional with the work that we are doing. We're doing a little coalition building. And so we would love to have you all a part of that. I'm sure you all are doing great working in communities, and we would love to have you a part of our coalition to continue to grow it and continue to kind of expand the work that we're doing in harm reduction and recovery. So I'm going to put my information in the chat, my telephone number, email address. Please feel free to reach out to me. The work group has not had its first meeting, so if you want to get tagged in for that, I can get you the doodle poll that we currently have out to schedule that first meeting. So without further ado, thank you so much, Lee, for inviting me.
Thank you, Timothy.
I may have missed this, but did you let us know if the meeting was virtual?
Yes, the meeting, of course, will be virtual.
Awesome.
Yes.
Thank you so much for sharing.
Well, thanks, Timothy, and I really appreciate it, because I think that the Illinois Harm Reduction Recovery Group is where I've kind of really been able to hone my knowledge of the whole legislative process. I mean, after all these years, I've just been kind of on the program side. So, but I also don't want to be the one person on the West Side Task Force that's kind of feeding the great work you're doing to the community. And I think we need a lot of voices and a lot of eyes involved in this process with the IHRRC. So thanks for being the ambassador for that whole piece. And I know we've got Dan Rabbit on here, and I know we've got Chelsea, who are also very strong. Well, actually, Dan's the chair of it, and Heartland is the sponsoring group. So anyway, so now let's
Lee, before we move from from Timothy Jackson, it would be great for the task force to have a strong emphasis on people with that may be living with HIV and AIDS, so that we can have a nice focus. I mean, on that. That brings lots of added value. If you could, AIDS Foundation could step up with us on that.
I can definitely do that. I plan on being on these calls moving forward as a person living with HIV. So do want to put that out in the space. So you're absolutely correct, Representative Ford. And it's definitely a natural intersection, and we can definitely work to add more from that space to this space.
Especially when we talk about intravenous drug use as well. I mean, all of the things that the AIDS Foundation advocate for and work for, I like to make sure that we bring it right in. And it's a good opportunity for the AIDS Foundation to be right here on the West Side.
Right.
Great, thank you, Rep. Ford. So let's move to my good friend and colleague, Sue Pickett, who is everywhere. You probably got 4 emails from her this week. From the
next week. Watch out. There'll be a lot coming next week. Thankfully, yes. And this is actually a preview, if we want to talk about an email that will come from the task force. One of the things that I have the pleasure of doing is working with Super, and Super is planning several learning collaboratives for their licensed organizations around behavioral health needs and resources in some of our most vulnerable communities, including communities on the west and the south sides. So they've put together a community needs assessment that I'm helping them to get out and helping get the word spread about this needs assessment. We want to hear from West Side residents, South Side residents, West Side, South Side organizations. You can do the survey online. It's really quick, really fast. Asks about what resources exist in your community, what resources you think need to be in your community, but we really need your input. And so Lee has graciously agreed, although maybe Sandra will be the person who ends up doing this, I'm not sure, to send out an email invite that tells you all about the survey, includes the survey link. If technology is not your friend, my team at AHP is more than willing to talk with you by phone and read the survey to you over by phone so that everybody has a chance to participate. So we're hoping to get this done in the next couple of weeks so we can feed that information back to Super and they know exactly what topics to address in that learning collaborative. So I was wrong. Yes, there will be an email, but an email sent on behalf of me by the task force. So thank you so much for doing that. Really appreciate it. And I've also reached out to the Southside Task Force as well to help distribute that information. The other great news that I want to share with you is to give you a quick update on our overdose prevention site project. I have the even better great fortune of working with Lee and Lou on this project and Al as well. And many of you who have participated, thank you so much. This is our project to share information with everyone on the West Side about what an overdose prevention site might be and to get your feedback and input on this. So in October, we held 2 more focus groups. I want to give a shout out to Frida Enriquez because I saw her listed as a participant from Haas. She was so instrumental in helping to get the people together for our focus group, people who serve Latinx residents who live on the West Side. So Frida, thank you for that. We did that focus group. Frida also was very instrumental in getting out surveys in both English and Spanish to our Latinx community members on the West Side. We have 158 surveys that were collected that we're in the process of analyzing. We're going to analyze them with other surveys as well. And we keep that link open so we can continue to get information from folks. We also had a focus group in October with West Side residents, and we had a focus group early in December with members of CPD who serve in the districts that are on the West Side. So I'm in the process of writing up the summary of all those focus groups. We have meetings scheduled with our local expert panel next week and the following week with our Community Advisory Council. We're really pleased that we were able to bring that group together this fall so that we've got guidance from people in the community who've given us some great suggestions about additional activities that we need to be doing to be educating the community and getting their feedback on OPSs. So thank you. Lee, did I forget anything?
I don't think so. Thank you. But if anybody, if you have not seen the phase 1 report, the evaluation report on the overdose prevention site community education, or excuse me, community engagement project, make sure you email me or put something in the text and we can get that out to you. It's a very good report. So yeah, great. Thank you, Sue.
Thank you. And when I saw there was a comment, there was a question about whether there will be gift cards, Sandra. I'm sorry, Sandra.
Don't worry.
I'm doing your job. I'm sorry.
No worries.
Whether there are any kind of incentives for doing the survey, and they're not. We're just asking people to do this of their own free will. Sorry, there's no gift cards. It's really, if you do it online, takes 15, 20 minutes tops, actually a little bit less, unless you are a super licensed organization. There's some more information that's required. So average person, I would say, takes you 10 minutes to do the survey. So thank you.
The gift cards were a feature or have been a feature in the past with some of the focus groups, but that's not happening right now. Is Anna Mebane on here? I don't know if I'm going to put you on the spot, but there was another survey going out that really is looking at identifying who's doing outreach. And it's coming from CDPH. If you want to just fill us in a little bit about where that is.
Hi, everyone. My name is Anastasia Mebane. I go by Anna for short. I'm a contracted public health administrator with CDPH for substance use. And so right now with the city, we're trying to map out what outreach is in the city, who's doing what and where, both on the west side and the south side. So pretty much, I've created a survey which we're going to modify the way we're doing it, because me and Lee discussed how the spreadsheet was just kind of difficult to access. So we want to make it easy for you all to put input information about different organizations on the south and west side who are providing outreach. And pretty much it's really easy. The metrics are just, you know, who you are, where you're located, types of outreach you provide, understanding that outreach of different organizations may differ, and we just want to know who does what, a good contact person and phone number, and a few other metrics that we're discussing. I have to recreate it. I want to make sure that it's exactly what my supervisors would like, but I'll be in communication with Lee about that, and he's going to help me get that survey out to you guys.
Great. Well, thank you for that. And we'll get that out to everybody.
Before she goes,
sure.
No, the city, one responsibility. How long have you been in your role? And
for a little over a year.
Okay, so I don't know if you know the commitment we have from the city, the county, and that is if there are grants available for community-based organizations, you send them out to us so that we could share it with all of the CBOs.
Mm-hmm.
So if you have any opportunities that's coming from the city, please share it with the task force so that we can share it with all of the members of the task force, and feel free to share it with individuals of the task force, but please don't forget to do that.
Can you repeat that? Because I'll make sure that I'll mention that in a meeting with my supervisors. Can you?
Yeah, so if there are any grant opportunities available for anything, please share it with the task force.
Great,
Absolutely.
thank you. And I know that Cherie Ariozola Martinez is on, and we're lucky to have her, that she's serving on the steering committee for the Illinois Opioid Crisis Advisory Council. So I don't know, we talked about, I didn't put you on there because I didn't know for sure if you're able to stay on the whole time, but did you want to share any comments from your point of view as part of the steering committee, Cherie?
Yes, thanks for, thanks for making that segue. So I was appointed to the Governor's Opioid Prevention and Recovery Steering Committee, which was an initiative under Governor Pritzker to try to take an equity approach to the opioid crisis. And so that steering committee is charged with really directing the work of the Illinois Opioid Crisis Response Advisory Council, which has already been in existence for some years now. And, one of my main points of contention, not contention, but one of the things that I try to enforce in all of the recommendations that are being developed is the notion that, we have to look at housing, employment, and those issues as not fringe issues to the opioid epidemic. They cannot be considered other. They cannot be continued to be addressed in, healthcare issues can only be a HFS issue. Housing cannot be only an IDA issue. If you can't address somebody's basic needs to live and to work, then treatment is really just getting at the use and not the structural barriers there are, especially for people with records returning to the South and West Sides who can't even get an apartment because of their record, or employers who only want to look at people who have a felony from 7+ years ago. So that's just the thing that I keep trying to preach, and it's been really received well. Lieutenant Governor Stratton has completely has that same mindset, which is so refreshing. And there just seems to be an overall consensus that yes, we have to look at those issues. Now, how do we ensure those issues get looked at is a whole nother issue. So right now they are looking at 85 recommendations on the new state opioid action plan, and they've been assigned to different agencies. And deflection is one of them, increasing pre-arrest deflection programs throughout the state, reentry, trying to get everyone, Narcan as soon as they leave Illinois Department of Corrections. So now it's a question of the how. I think we've been talking about the what for years now. How do we move those things forward? How do we make recommendations so concrete that there's no room to not move it forward? So that's kind of where we are. And, it's stuff that we've been talking about for a long time now. And so it's so great to have this opportunity to actually move the needle on some of these issues. So that's what I would say.
Does everybody know what organization you work for? I don't know if you mentioned.
I'm sorry. I'm Cherie Martinez. I'm the AVP of Behavioral Health at Safer Foundation. We have a community office on the west side at 808 South Kedzie, near in between Harrison and Roosevelt. And then we also operate 2 work release centers on behalf of IDOC, Crossroads, and North Lawndale. We're actually got a grant to implement medication-assisted treatment at North Lawndale and Crossroads for people who are still serving their sentence there. And we're working with UI Health to provide 2 forms of MAT, Suboxone and naltrexone. So we're working to implement that, which is really exciting.
Thank you.
Cherie, I want to, Lee, if I might, piggyback on that a little bit. I know a couple of meetings ago, Rep. Ford hosted a community meeting to kind of get our voices out there. And we talked about non-traditional education and training and development for community residents or for just the providers to make sure that those life skills necessary for navigating some of those barriers are education that we're actually giving folks, so that the navigation of barriers becomes easier, and even connecting yourself to some of the resources here on this call.
Yeah, I don't know which meeting that was. I apologize. Maybe if there's future iterations. I've been super busy with the peer effort, which is the work to help provide reentry support for over 1,000 people who've returned to Cook County from DOC since March. And so I haven't been as engaged as I like to be, but I do try to talk with Lee, and I talk with Sue Pickett, and they kind of flag things for us. We did see the grant opportunity that was released. Lee shared it with the group for some small grants, and we're gonna try to apply for a digital literacy grant so that we can hire someone who can teach clients how to use cell phones. Right. And how to get a Gmail, how to look at their calendar, how to use Google Maps, and then also create a curriculum to because that grant's not going to be forever. So how to create a curriculum that other people can then use, and videos and stuff, because we've had people come out of prison who've never used a cell phone in their life, and they need the cell phone to do these video calls and to do these these job interviews. Absolutely. So all of that has to be included, and the more that grants can carve that out in funding and allow us to use our creativity to fund what we know our clients need is really helpful. So yes, I completely agree with you. I think technology can bring more access to everyone, whether it's a Safer client or any other person or of any other organization. If we can have dedicated individuals to provide that, we can make these things available to the to the community at large. So I'm definitely interested in this topic. It's needed. It's not an extra topic. It's a crucial topic right now.
Absolutely. Thank you so much for before we move forward though, Rep. Ford, Cherie, there is a call for you to get your information into the chat box. If you could do that for us, please. Rep. Ford, I'm sorry. Thank you, Sandra. It's Cherie. If I could just comment to the need for that technology support. I had a meeting with some people that had just been released from prison, and they were in prison for years. And one person needed an ID. So I called the Department of Corrections to try to help them get their ID. There was one time in my life that I could feel that I could honestly say there's a lot more, but this was one time that I could say that I was very insensitive in a response. So I called the Department of Corrections to give the phone to the person that just was released out of prison
after 25 years. I gave him the phone to talk, and he put the phone, he didn't know he had to put the phone to his head. And I laughed. I'm like, dude, what's wrong with you? You mean, because the guy from the Department of Corrections kept hanging up because he I couldn't hear him. The guy really did not know how to use a cell phone. I could not believe it. And I was so insensitive because I actually laughed, because it's like, dude, you got to put the phone to your head. So I hope that we could support that initiative to get people technology support when they come out. It's really necessary.
Absolutely. Before we move forward, and thank you for that response, Rep. Ford, and let's get you into some sensitivity training, because there are folks out here who have not been exposed. That's a great, great point. But we have a call in the chat box for Anastasia to put her information in the chat box. She spoke earlier, so if you can please get your information in the chat box. And then Laura said, to Sherry's point, that it's really important to make sure that we have funding to support future telehealth. So Laura, if you want to speak to that a little more, please unmute yourself and do so.
Sure, thanks. And not just funding. I think funding for devices and minutes and all of that kind of stuff is really important for increasing access. But some of the policies, the emergency policies that we've seen put in place because of COVID, so that folks can continue to access all kinds of services through telehealth, particularly behavioral health services. We want to make sure that, it works better for certain people. We just don't want to go backwards on some of that stuff. We want to make sure that the stuff that has been working well for people and that can work well for people and for the providers who are offering services via telehealth, that we can keep some of those emergency policies and make them not emergency, make them enduring. I see Cherie unmuting herself. I don't know if you have anything to add to that.
Yeah, I would agree. I mean, the super DHS gave us the ability to obtain verbal consent until we're able to make an in-person contact, which allows us to help someone in the then and now, instead of saying, I can't help you until our offices open back up, and then we can talk. So that's crucial, and that needs to be maintained. I forgot to mention, we're starting to explore digital platforms. We have Safer Return website where it's mobile friendly and people can start requesting reentry services online. And we've gotten requests from outside of Cook County of people across the state wanting this resource. So I'm super, again, interested in this topic. If there's other opportunities to push for digital literacy infrastructure across the board, I'd be interested to learn more.
That's all. Go ahead. Sorry.
I was going to say, I think there's a coalition of the broad healthcare sort of stakeholder constituency working on some of the telehealth issues. So I think it's important that the behavioral health folks and people who are receiving some of these services this way, that we make sure that our voices are heard and prioritized in that larger stakeholder group, which is good, which includes all of healthcare, right? And I think to the point that Cherie was just making, telehealth can help solve some of the access problems and the deserts and all of that stuff that we've struggled with for years around the state, not just COVID related challenges. So that's all I'll say.
I was going to say that's also something that I know Dan Hostetler from Above and Beyond was mentioning about being able to continue telehealth and actually have the technology support. Dan, are you still on? Did you want to elaborate on that?
Yeah, we've kind of split our groups so that we're actually prescribing people into them, because we have transportation problems. We have huge transportation problems. Most of right now, over 60% they have trouble getting on trains and navigating. And did that hit home with what Rep. Ford just said a few minutes ago about the guy that he talked to that didn't know how to use his cell phone? We have to sit down and don't have credit cards to put in Google Play Store apps. So we have our counselors actually doing it, and they're not all that equipped to be able to do it themselves. So any kind of assistance that's out there right now. Believe me, that really perked up my ears.
Yeah.
Appreciate the comments.
Oh, yeah, yeah.
Great, Dan.
I want to get Ann Burke, though, in the conversation as well, who says that Super needs more funding for community outreach. So if we can shift this conversation more to outreach. Ann, you want to unmute
with the advent of COVID, we had to, especially Julie Skopna's program, the diversion program, which weren't arresting as many people, which is good. But we were trying to use our resources and we put it more in outreach. We had a big movement with Prevention Partnership, Blue Size group, and meeting weekly at Jackson and Pulaski. I just think that, and I think Sherry Martinez and I spoke about this several months ago, is that I think we need to see the value of delivering services in the community and counseling in the community, like Mark's idea of recovery coaches, and that not all people are going to be able to reap the benefit of coming to a place with 4 walls to get treatment, that it may not just be an option. And there's transportation issues, and even if you have Medicaid and you have transportation, it is like an act of Congress to get a ride to a site and get that ride to pick you up. There's and always takes a lot of support. And I hope that this continues to. I know that they've loosened up their cap on community outreach and paying for it, but I still think there's so much more we can do to deliver services.
Right, and that's really almost a topic of a full meeting, the whole outreach piece that's really come from the relationship that the West Side Task Force Outreach Team and Lou and his squad, and how we connected with Thresholds and Night Ministries, et cetera. I mean, it really, it's interesting that we've reached this point in the day. We haven't really talked about it as much. Right. But that's a real key piece. And I know that right now there's a revival going on. It's 24/7 revival for the next probably 20 days or so. Right, right at Jackson Pulaski, there's a big tent, and it's warm, and various services. There's been haircuts, there's been OEND services, there's been a lot of religious presentations, et cetera. We have Elise. Do we have Elise Edwards on here? She's the one that's kind of been, letting everybody know about this and getting people lined up. Elise, you want to say hi?
Hello. Sorry. Hello, everyone. How are you?
Hi, Elise.
I'm doing well. How are you guys? Wow. I recognize a lot of names, a lot of faces. Nice to see you all. Did you want me to talk about the revival tents?
I just want to, we don't have much time. I just wanted to, but Elise has been rounding people up and getting them over there. And anything happen in the next few days that we should know about?
Definitely on the weekends. So on the weekend, Saturday and Sunday, we are, trying to make sure that we have a very high number of participants. So we have free haircuts from 12 to 3. In the tent, and we have a food pantry. So that's Saturday and Sunday for the free haircuts from 12 to 3, and then the food pantry is just on Sunday. If you guys could, whoever is on the schedule volunteering at this time, we're really trying to, let the population know around there that they are welcome to come in the tent. And I think that they're a little hesitant. They think that it's just for church, or it's not. It's heated and it's for them.
Great, thank you. And Elise is a great example of somebody who's not in the field, who's a change agent, and actually really, putting us our feet to the fire to get connected, and really appreciate it, Elise. Your kind of energy and dedication is really what we want to make sure that we can impart to the community and get from you as well.
Yes, thank you.
I wanted to interject and say that Elise found us on our Facebook page, and you too can follow the task force Facebook page.
Yeah.
West Side Heroin Opioid Task Force. That is exactly how she got connected with us.
Yeah,
so the power of social media and us meeting and working together as a community is a big deal.
Right.
Thank you. So happy.
Fantastic. So we're reaching. Brian, you got called out. Do you want to say something, or because we all of a sudden I see you live?
No, I appreciate the work that Elise does too. We're working very closely, and you know, the helpline does serve as a really good resource for people to connect to harm reduction and recovery services through the 833 to find help, through our interactive website at helplineil.org. And now there's a new text feature. Elise has got some great materials down there. I encourage anybody else that may want some more information about the helpline, maybe a presentation at your community group or your organization, any materials, I can definitely help with that. So I appreciate the conversation today and everybody's hard work in these challenging times. And kudos to everybody. This is a great meeting.
Brian,
thank you.
Are the best.
So,
thank you for your
so let me pass it on to our convener, the Rep. LaShawn K. Ford, to wrap it up and move us on into the next step of our work.
Oh, thank you so much, Sandra and Lee and Lou and Al and Veronica and everyone on here. Tate, thank you. Tate, show your face so you guys know who's at my office.
Jonathan, make note, he called you out. I did not.
Jonathan is, let me just tell you guys, I know everybody has to go, but Jonathan was my student. He was, I think he was a 6th grade student of mine. And that goes to show you that he's older now. And he found me on social media, and he volunteered at the office for like 2 years without getting paid. And so he's also an Air Force veteran and a National Guard veteran. Any other veteran, Jonathan? Yeah, and he just nodded. He didn't join any other band.
No, so I was active duty Air Force, and I was National Guard Army.
Yep, and
for 12 years.
12 years. Wow. And so I appreciate Tate. I appreciate everyone on here. So if you notice also in the chat, we can't let it go by. Yeah. Task force is so important that we have AIDS Foundation even talking about they provide support for housing. So this task force has a large umbrella, and I think that we should continue to grow it because we know people with substance use disorders have, just like all of us, have lots of issues. And some of us are just so lucky that we don't, that we use other substances like red wine or beer or things like that. And we're able to do whatever, or we do whatever we need to do. My pastor's on, so I better say we pray. Otherwise, he'll be mad. He'll say, "Oh, so you rather drink than pray, huh?" So thank you so very much, and Happy New Year to everyone. And Pastor Walsh, thank you.
I would never say that about Rep. LaShawn Ford. And I just want to say how clean cut you're looking today, all right?
Yeah, he does. I didn't even know. And by the way, that's the first time I've ever seen Jonathan Tate. So good to see you, Jonathan. Now I got a face to go with the name. So everybody go in peace, and thank you so much. Wonderful. We'll be getting this information out to you early next week, and take care.
Well, Lee, my pastor was really, you took his line.
Oh, go in peace.
That's what he always say, go in peace.
That just bubbled up in my conscious.
All right.
And then at the meeting,
you got a lot of regulation out here today, Pat.
You got to say thanks be to God when they say it's over. All right.
All right. Have a good one, all.
Thank you all. Thanks so much for your time today, Rep. Ford. We really appreciate Mr. Rush, as always, a pleasure to serve.
All right.